Hey, podcast fam, what is up? Today on the show, we have Wendy Wiggs, the founder and owner of PRP Regeneration Specialists. Wendy is passionate about helping people achieve their best life and saw the need to offer alternative treatments for joint and tendon pain. Many people do not want or need surgery and do not want to take medications long-term for joint pain, tendinitis, and muscle strains. Wendy decided to become a specialist in PRP treatments so people could get back to doing the things that they love as quickly as possible and receive these treatments locally. In this episode, we dove into a whole bunch of great stuff. How does she balance the time between being a practitioner and a business owner? The importance of limiting costs, setting those boundaries with friends when they are also your patients. Her biggest lesson learned since she started. We also talk about Google reviews and making it easy for your customers. And it was a fantastic episode. Let's go. You are listening to WHOA Podcast, coming to you from Gainesville, Florida. Hello, everybody, and welcome to another episode of the WHOA GNV Podcast, the podcast bringing you businesses and individuals that make you go, whoa. Almost like, it's like becoming a game now.
It's
is.
Like, whoa. I try to give you a different whoa every time. Mostly it's just the Joey Lawrence whoa.
Dude, man, how are you?
Dude, the episode releases in October, so we've made it to the last quarter. Q4, here we are.
Dude, we're going to make it through. Everybody's going to make it through. We're going to be just fine. We got 3 months to go. Like, let's do this.
The home stretch.
The home stretch of 2020. I mean, I think everybody's just being super optimistic, just like really hoping. There's just a lot of hope that 2021 is going to be a lot better for everybody. Right. Am I right?
That's true. Cheers to any businesses out there. If you have a chance to not take a loss this year, then the home stretch is here. I mean, well done, because I think if you could look back on everything that's happened this year, I mean, we've been through a lot. So yeah. If you're still alive and kicking, you deserve something.
What would you say is your biggest business lesson of 2020?
I think that I don't want this to sound the wrong way, but I think that sometimes you can believe that something like COVID wouldn't happen, and the likelihood of it happening, you don't consider it, and you just catch yourself with the proverbial pants down. You're just not prepared for a situation like that. And I think on the flip side of this, like I said, if you're thankful enough to have persevered through this, you're going to be running business a lot differently than you did before this, in case anything like this ever happens again. Yeah,
I would say adaptability.
Yeah.
The ability to like really, just pivot like so quick. That was like one of the big words, especially when we were doing the coronavirus sessions, is like, you gotta pivot. Everybody was pivoting, right? But like seriously, the ability to adapt to what's gonna happen next. And I think that's what's, even going back to school time for us, when we're looking at, okay, well, is the University of Florida gonna open up, or are they not gonna open up? Do we need to hire more team members? Do we not need to hire team? It was just being able to really flex during those times was critical for us. And so I guess that's my biggest lesson, is be adaptable, people. Be adaptable.
I'm sure everybody's tired of talking about COVID and all the impacts too, but well,
there's a lot of lessons to be learned. And again, I think, if there was one thing that I can really, reflect on again, like, and I know this has gotten brought up a couple times, is really the fact that we were all in it together.
Right.
Like, I can't remember anything that has impacted, every business, every person, in some way. Right. And I don't know, that was just a very unique aspect to it, I guess.
For sure.
Anyway, moving right along.
Right.
You guys, we want to remind you that we have these Gainesville, Florida t-shirts available. Hopefully by the time this episode releases, there's still some available, because we're recording a few weeks in advance. But we printed 150 of these, and just this beautiful logo. Again, this was a collaboration with Caroline Staninsky, who was on the show, just a lettering artist, absolutely incredible talent. 50% of the proceeds are going to go to her, and the other half are going to go to us, in terms of just going to help us fuel this show. Keep plugging along. So definitely go to whoagnv.com, click the shop link, and it'll take you there, as well as like all of our other swag. You can check it out there as well. So definitely buy your Gainesville swag, y'all.
That shirt is definitely in one of my rotations now. Like I kind of I have a closet full of shirts, and I pick the same 5, and that's one of the 5 now.
Well,
Really
and it's
love
like
it.
the super soft, right?
Right,
It's
that's
like
why, I mean,
the soft
you can't
teas
go
are
wrong.
like the best. So anyway, let's get in today's show. Are you ready, Mike?
Yeah, I'm ready.
All right.
I
Today
have
on
to
the
learn
show.
something today.
I know you are. I feel like this is gonna be one that you really like, just
Yeah.
in terms of like, I don't know, you're just one of those guys.
Science background.
yeah, the science guy. So today on the show we have Wendy Wiggs, the founder and owner of PRP Regeneration Specialists. Wendy, welcome to our show.
Thank you so much for having me.
Yeah, absolutely. We're excited to have you and to dive right in. So we always like to share the story first, right? Like, we're always fascinated with why people are doing what they're doing today and how long the journey's been. So kind of take us back to this journey and where it started for you.
Yeah, I grew up in Gainesville, actually. My family moved up to Gainesville from Miami when I was in the 8th grade. And I actually went to Oak Hall. And I graduated from Oak Hall and had 19 in my graduating class. So it was very small back then. And my parents thought that I would make a great nurse. So they enrolled me in the Santa Fe nursing program, unbeknownst to me. So I graduated and I didn't have a summer off. I went straight into nursing school, and it was a fast track program at that time. So in a year and a half, I had my RN degree at the age of 19, and I was out on my own. And so I started working in various fields of nursing, from cardiac to dermatology. I actually helped start the Mohs Skin and Cancer Clinic here in Gainesville, Florida, for the University of Florida. And I worked in the ICU at Shands for 6 years and MICU. So I think, all that background in nursing kind of drove me to the passion of wanting to do more for my patients. As an RN, you are somewhat limited and you can't order Tylenol without a doctor's order. And so after about 25 years in nursing, I just decided I didn't want to do floor nursing for the rest of my life, just because I knew I was getting older and it's very rigorous. I mean, the time, 12-hour shifts, and the physical and mental ability that it takes to run those shifts is hard as you get older. So I really had to look to the future. I decided to become a nurse practitioner. At the time, we were actually living in Lakeland. My husband's a baseball coach now for the for Santa Fe Community College, but he did play at the University of Florida in 1988 and 89. So anyways, we moved a lot for his career, and so ended up down in Lakeland, and I went to University of South Florida, and it took me about 5 years, actually, to get my graduate degree in nursing, but I fell in love with it, and it really was my passion coming out of nurse practitioner school to really make a difference or make an impact in people's lives and really focusing on prevention and health and wellness versus disease and sickness. And so that's kind of what's driven my passion when we moved back up here, because he got the job at Santa Fe, which is amazing because we always wanted to get back to Gainesville and raise our 3 daughters here, which we were able to do. We really found that, things just kind of fell into place for us. And I got a job first working in urology as a nurse practitioner, and then I quickly, after about 6 months, transitioned into working into a private gynecology office for about 8 years. And that was great, really good experience, and I really started bringing in primary care to the women that I was taking care of in gynecology, and really had a passion for helping people get as healthy as possible. And I did advanced lipid panels and, really above and beyond what you might normally get from a gynecology office. But after a while, I just decided that I felt like there was something more in my life, that I've always wanted to own my own business. And actually, when I was working at the gynecology office, I started a nutrition panel that I was offering patients that wanted to come to me. It was called Gainesville Total Body Wellness. And it was actually about a 22-page report on your nutritional fitness, and looked at all the elements of nutrition as far as your amino acids and vitamins. And I think that's kind of what started driving me, like I could do something more. And that sort of led to me pursuing getting into orthopedics. So I took 2 separate jobs, 2 part-time jobs after that, and trying to find my way. I just didn't know really what my plan was, but I just was kind of following, where I thought I was supposed to be. And I worked in primary care, and I also worked in orthopedics. So I started doing knee injections for osteoarthritis and sort of fell in love with those patients, just really making a difference in their life. You get people pain-free. to me as a nurse and a nurse practitioner, it makes you feel very gratified. And I think that's why we go into the healthcare field, is to make a difference in people's lives. And to me, that became a niche. So I can keep going. I found out about platelet-rich plasma. I did a seminar in Orlando, and it was at a chiropractor's office that was thinking about bringing in these treatments in their office in addition to what they were doing. And I just fell in love with it immediately because, platelet-rich plasma basically comes from your own body. It's all natural, and it has healing properties. I mean, it's designed to heal and repair tissue, damaged tissue specifically. And it can be used in orthopedics, which is what I was looking at, but it also could be used for other things like aesthetics and sexual health and wellness, and many other things, hair loss. So, I just thought, wow, this is pretty amazing. I brought the treatment, and I actually developed my own treatment in a chiropractor's office with using PRP, but he was strictly treating knees, and I felt like I really wanted to treat shoulders and other areas of the body, and that's kind of what led my passion to open my own practice. Was, I really wanted to treat more than just knees, and I was getting amazing results, and I was referring my own patients from primary care to myself in the orthopedic world because, there was definitely a need, and I can tell you more about that.
Okay. I was waiting to see if Mike was going to glance over at me when you were talking about knees and stuff, because I've had this knee injury going on since June, playing capture the flag with the kids. Probably need something.
Some PRP injections.
Yeah, probably. So I'm really interested. I want to almost take it all the way back to the very beginning real quick, because you said that your parents unknowingly enrolled you into this nursing program. I mean, if that didn't happen, do you have did you have anything in mind as to what you wanted to do?
Nope. So they picked it for me.
They just did.
I had no idea.
They're just all right, nurse, go.
Just arranged marriage. How old were you at the time?
Well, I was a senior in high school, so 17.
Did that make you feel awkward or anything?
No.
You're just kind of okay, go with the flow?
Yep.
Yeah?
Yep.
Okay. That's super interesting.
My dad was an endodontist, so he was very brilliant. I mean, he had his own practice in Miami. He was actually dual certified as an oral pathologist and endodontist. So whatever he said, I trusted him. He was very smart, and I think if they saw something in me that I wasn't seeing in myself, I just trusted that.
So real quick, what were your hobbies in high school? What did you want to do?
I really didn't have a passion to do something beyond high school. That sounds kind of odd or weird, but I was really kind of living in the moment when I was in high school, and I really wasn't thinking about the future. A lot of my friends were talking about going to a lot of Ivy League schools, and I sort of admired that, but I never felt like that was something I could do. And so I thought the school was pretty hard. And so I just didn't really see a passion as far as that. I rode horses in high school, so that kind of separated me from a lot of the students that I went to school with, because I didn't play. I was a cheerleader a little while, and I did some other sports, but really my passion was riding horses and doing 3-day eventing here in Gainesville, and that sort of separated me from my peers a little bit because it's an isolated sport. And so, it was interesting that I didn't really have a drive of what I wanted to do. So I was kind of thankful that they picked something for me. And it's turned out to be wonderful. And I have a daughter that's a nurse who's amazing. So to be able to pass that on the lineage.
Did you sign her up?
No.
No,
I did not. But I think, you just either have the gift or you don't. And we all have our own special gifts that we have to offer to the world. And I think it's great when you find your passion and you find your gift, and then you can really monopolize on that or pursue that. It gives you some focus. So
at what point, in this, that you decided to create your own business?
Yeah, I think, when I was first in nursing, or for a long time, it was a job. It was just something you do. And the nice thing about nursing is you can jump around different fields, and it's not considered a negative thing. Like some jobs, it's kind of a ding on your resume if you do different things, but not with nursing, I don't think. We're kind of unique. So I did kind of try different areas to see where where my specialty was. But I think, I think I really wanted to practice nursing the way I felt like it should be practiced. And I was kind of finding that when I was a nurse practitioner working for other people, that, working with insurance, it's kind of like very driven, and you have to see about 25 or 30 patients a day. And I really wasn't programmed like that. There's a lot of people that are very, time-oriented and they can get things done in a short amount of time. But I think as a nurse practitioner, things are a little bit different. And even as a nurse, we really are focused on educating our patients, giving them options, and listening to our patients. And that can't happen in 15 minutes. And I quickly realized that, that really wasn't the perfect environment for me, being in a private practice that was definitely profit-based. And so that's kind of what started pushing me to practice nursing the way I want to, and the only way I could do that was to open my own practice. And now I spend at least an hour with every patient that I work with.
Wow. So how long had it been before you pulled that trigger on doing your own thing?
I think it was kind of gradually brewing for a while, but probably 2.5 years when I left the gynecology office and I started working 2 different part-time jobs trying to figure out where I wanted to land.
So what year was the business founded?
2017. So
Okay.
we're actually in our 3rd year.
How's it going so far?
Awesome. Yeah, it's been amazing because, you start out with 0 patients and, now I'm up to like 500 patients
And were you able to bridge some of that from previous connections?
People that followed me, that really, liked the way that I practice medicine. They liked my approach to problems. And, a lot of my patients, they become my friends. I care about them. I know about their families. And I think that makes a difference for people when they, feel comfortable coming to you and they can pretty much tell you anything and they know it'll be in confidence. And you're willing to listen and take time with them, because that's just going to come back tenfold, all the way around. And so, yeah, I have had people that have been following me for over like 15 years now, which is really a blessing. And I'm really thankful for that. And they trust me, they know me, they like me, and they want to stay with me. So, I just opened up some gynecology services, and a lot of my patients that are my former gynecology patients are super excited about that. But, I just want to really do the best I can for the people that know me. And I think our biggest growth is word of mouth. And that's one of the most powerful ways to grow your business is, somebody knows you and they've had treatments with you and they got better and they recommend you. That's the most powerful advertising there is.
Oh, for sure. No doubt. So tell me a little bit about so this transition, I feel like this is a really big transition, right? Going from like being a nurse to owning your own business. How do you balance your time? Are you more business owner than practitioner, or have you been like, let me hire somebody to handle all the business crap so I can do what I love over here? You know what I mean?
Yes.
Because I feel like, I don't know, when I look at my business, there's so much about business that I hate. I love being an entrepreneur, but there's so much about business that I absolutely can't stand. So I'm like, all right, who can I hand this off to so I don't have to do these things? So I'm just really kind of interested in the balance once you made that transition. Maybe you can speak a little bit to that.
Absolutely. It was super scary. I think that it did take a huge leap of faith to leave a secure salary job where I had, a set income to not knowing what my income would be. And I just wanted to know if I could do it. And just hearing about so many leaders, I can't rattle off all their names, but learning that other leaders have done things and, maybe it didn't work out, but then they came back and they tried again and that it did work out. And I think that, I was like, well, what's the worst that can happen? I fail and I go back to doing what I'm doing. But if I don't ever know and take that leap of faith and try it, I'll regret it for the rest of my life. And I think there's nothing, more freeing than being a business owner, as far as you get to decide how hard and how long you want to work and what hours you want to work. You don't have somebody telling you that. Although as a business owner, we work really hard and we put in a lot of hours that we don't get compensated for. But I feel like it's worth the journey for what we offer in our practice, in our community, that it's needed. Like, I need to do this. And I know that if it's the right fit for Gainesville, it's going to succeed. And so far, every year, we have done better and better and better. My accountant's always like, man, you're just killing it. And I can't even believe it. And, in your first year or 2 years of business, that you're doing so well. Most places, take a loss initially. And I think it's because I was so conservative going in. I got a really small space. I had, myself as doing the treatments, and then I had one other office worker who's like my office manager, who does everything in the business. So basically, we really just limited our costs starting out as little as possible. And so that way, we didn't start out with gangbusters and big expensive rent and lots of employees and payroll. But you're right, like, we first started out doing our own QuickBooks, which I quickly learned, like, this is a nightmare, and I'm not an accountant. And, so you
handed it off. I mean, you've had the business since 2017, so you've already handed that off?
Yes.
Okay.
So
it took me 10 years. It took me 10 years to hand that off.
No, after 2 years or a year, my CPA telling me, your books are this or that, I was like, okay, we've got to get a professional here. So, you can't do everything, although I do a lot. So I think, a healthy balance that I'm shooting for is 40% procedures, 60% administration of the business and running the business. Right now, I'm 100% in both roles, so that's really tough and time-consuming. But I think I'm excited because I've just started working and contracting a CFO to help me really look at the future, who I need to hire, and so we're looking at hiring more help to help me do the treatments, so that will free me up to do more of the business. But yeah, it's a big animal when you start out by yourself and, not knowing who to call or who to hire. I think as far as marketing, I've done like every venue possible. And
so how many team members do you have?
Right now I have 2 part-time secretaries, so they work 4 days a week and they split 2 days each. And then I have a office manager and myself. And I have an RN that works 1 day a week, but I'm going to replace her with a nurse practitioner. I think that can help me with some of the treatments. So we're growing and expanding, and that's kind of exciting.
Does she know that?
Yes. No.
Like, it's going to be super awkward.
No, we've had a conversation. I mean, I wanted her to work more hours, actually, to help me, and she just couldn't give that because she has another job. And so, no, she's great.
Bringing those first people in, are you like... I look back at our time, the early days. It's like, man, I'm like recruiting like friends and that kind of thing. Is that is that the stage? It's like, hey, friends, like who wants to come work for my business?
I would say everybody that's worked for me has been in my chair as a patient or as a friend.
Hey, but that's really good though. It's so funny because one of the things that we often do here at the scooter dealership is when we put out notices like, hey, we're hiring, the first thing we do is send a newsletter to our customers.
Yeah.
Mm-hmm. And the reason we do that is because it's like they've been on the other side of the counter. They know exactly the kind of customer service we're going to provide. They know what we expect from our team. You know what I mean? And so they've already been through it from the customer side. So it's easy to get them on board when they're a team member. So I think it's great.
Yeah, so we're super excited as far as the growth. I just want to make sure we do it in a smart way, especially coming out of COVID. We want to make sure we make good decisions, and if another shutdown happens, which is always possible. This is a very volatile environment we're in, so all of us don't know what to expect next.
Did you have to close up shop for a little bit?
We did. We actually shut down for 2 weeks completely, when everything kind of was a little uncertain. I didn't know if we were allowed to be open, and so once I was validated that a lot of our treatments, especially for joint pain, is medically necessary. I mean, we can't have people just walking around in pain and suffering, and actually it was kind of a good time for a lot of people to seek some of these treatments because they were home and they were, down from doing their normal activities. So for us, it really worked out. We also do hormone management for men and women, and we can't have people not having the hormone treatments. So we actually did really well, but we did shut down for 2 weeks to just try to develop what's our policy and procedures going to be, how can we ensure the safety of our staff and our patients and make them feel comfortable. And because we're small, it's really nice because we already were social distancing. Our waiting room holds maybe 2 to 3 people. We don't make our patients wait, so they're taken almost immediately at their appointment time back to their rooms. So we don't really have a whole congregation of people hanging around. Everybody's pretty much socially distanced, and we just asked, if you're with your loved one, you either go back in the room with them or you wait outside, But so I think that our patients feel really comfortable. I have some definitely elderly patients that came and got treatments during that time, and I just thank them for, coming out and staying with us or seeing us. And I gave them the option to do telemedicine visits, but we want to make sure people feel safe.
Was that something that you were already doing, or was that a pivot that you made specifically?
No, we already were doing that, and we'll continue to operate in that manner, where people are separated, that they aren't going to be in close contact with each other. And I think that's an advantage of a small business, is you can pivot a little bit quicker, and you can make changes quicker internally to kind of meet the needs of the environment and the people that you're servicing.
Good.
So I want to ask a question, and I've been asking it 5 different times in my mind. I want to make sure it comes across the right way. I'm not you're a professional, and I'm not trying to be hee immature, but you talk about treating friends and stuff like that, and issues is sexual wellness and stuff. Does that ever become awkward that that you're in that personal space? Is it something that you would rather do? Do they seek you out because there's comfort with you? How does that whole dynamic work?
I think it works both ways. Because I did urology, which, I did prostate exams and wellness exams for men and women in that scenario. I think people started to learn and respect me as a provider. Although you don't see a lot of female urologists, they are out there, and I think it's becoming more acceptable, just like it is, now women used to only go to male gynecologists, now they go to female gynecologists. And I think being a health professional, people are able to put that aside as far as the friendship. If they feel comfortable with you and they know you're professional, and of course we follow all HIPAA guidelines, I don't talk about anybody's personal treatments or care with anybody, and our staff really upholds that. We talk about that all the time. It's very easy to get sucked into, oh, did my wife come in today? We are not allowed to say. So we even have a back door. If people want to sneak out the back door and not be seen coming in and out the front door. And I think we really go above and beyond to make people feel comfortable. And I've never really had an issue with that. And, if somebody doesn't want me to do their gynecology exam, that's fine. I respect that. I want people to feel comfortable, and I've never had an issue with that.
If they're your friend, though, are they taking random, they take pictures of, I'm thinking of my knee. I'm hey, is this something I should be worried about? Or, that boundary, right? That boundary of hey, this is office time. That's something that's come up a few times is boundaries. I guess that's what I'm asking is
okay.
How do you really maintain this balance of this is office time stuff. This is personal friendship stuff. You know what I mean? Don't text me with that, or don't message me with that, or or do you just help them? Or do you just help them? What's the protocol?
I had an incident on the way over here. Not an incident, but the same kind of scenario. And I think it depends on what it is. I have somebody that I'm working with that's a really good friend and also a patient. And I ordered some imaging for her, and she was texting me about, did it come back? This is after hours, and will you, email it to me? And I'm fine with that. I think it's more when it becomes more can you call in a prescription for me? And it's after hours. I think that's a little inappropriate, and so it is hard to set boundaries, especially with friends. because they do have my cell phone number and it's really easy for them to text me. But I think they respect me in the same way. And sometimes I'll just say, can you just call the office? Because what I find happens is that things start falling between the cracks. And that's what I'll tell them is, if you go through me on my text, I might forget, come the next day. But if you go through the office, they're going to send me a task message, which is on my computer, and I actually have to sign off on it and do it. So it's a lot less likely that, I'm going to forget to call in your prescription or order your MRI or, whatever it is they need. So my staff is pretty protective of me there, and I'm trying to get better. But you're right, it becomes a little bit of a fine line.
Yeah. So what's the biggest lesson that you've learned in 3 years of ownership?
That I don't know everything. I have a lot to learn. And I think surrounding yourself with really good people that like, and trust, that have your same mission and vision that you do, that passion and that drive to really, make the business successful. We're all in it together. And I really believe that the employees that we have feel that way. And that's what makes me nervous about, trying to hire in new people, even though I need help. It's just, are they going to have that passion? Are they going to have that drive? Are they going to want to see, the same vision that we see for our patients and develop relationships? Because, we are very close to our patients, and I think they come to us because of that.
Yeah.
As I was looking at your pamphlet that you gave us, there's soften facial wrinkles and lines, feel and look younger, and that part at the end, feel and look younger, kind of struck something in me. Do you find that people only go for those services if they say feel and look older to themselves, or is there a certain kind of maintenance? Like if you're a 20 to 30 year old person that wants to make sure that you don't develop wrinkles, is it something that people are being proactive about, or is it wait until you look and feel old and then do something about it?
Mike's genuinely concerned.
Hey, I'm all about the proactive. I don't want to look old.
He's all about being proactive.
Well, I definitely think the younger generation, as far as the 20s to 30s group, is very more proactive in especially seeking out Botox or fillers, things like that. But I do treat some women. I had a woman in my office today, 82. She's interested in looking a little bit better, and I told her, we can offer you some things. As far as filler or Botox and vampire facial, which is microneedling and getting the skin looking really healthy on her face. But I said, or you can, opt to do surgery. And I lay it all out for them. I lay out the cost. And I said, the choice is yours. Depends on how much you want to do. But, when you're 80, it's really hard to get them to look a lot younger, whereas if you do more maintenance and you prevent the wrinkles from coming in, then you're going to look a lot younger as you age. So I see men and women, they're both interested in looking as good as they can. And then when they're in there for Botox, they might mention their knee. And I said, well, I treat that too. So I pretty much cross-reference my own services. And so really I've kind of got a little cocoon of patients that just see me for everything. They can get their wellness exam. I do treat some men that are pretty straightforward with hypertension or maybe a little high cholesterol. They don't have a primary care doctor, so they do the hormone testosterone bioidentical therapy with me. And of course, I'm just not going to treat the hormones and forget the blood pressure. That just wouldn't be ethical in my mind. So, and they're not going to go see another doctor, most likely. I can just tell. And so I will just go ahead and treat their blood pressure. Unless, it becomes more complicated, then I will farm that out maybe to a cardiologist. If they start getting on 2 or 3 blood pressure medicines, I'm like, okay, I think you need to see a specialist. But if it's something, where one med will take care of it and I can monitor it for them, I think they're really appreciative of that. And then they know me by then. I'm doing their pellets, so we get kind of close in that treatment. So because that's in the subcutaneous part of the booty, I put little pellets in there, testosterone pellets. So I've already seen their booty, and so they're pretty comfortable with me by that point. But we really are changing lives in our practice. So we are helping people get out of pain, like joint pain. A lot of the men are really interested in the testosterone replacement therapy to help them feel their best. There's a lot of men that are in their 30s and 40s that are suffering from low testosterone. They just don't know it. And so we do blood work on them, and, you know, it really does change their life. I mean, they just thank me every single day, like, you've made such a huge difference. You know, you've given my life back. I'm able to go back to the gym. I'm able to start running again.
So I've heard you mention men more often than I thought I would in this. I mean, so what's your what is the percentage of demographics, men to female?
I would say definitely more females, but I think the men are starting to learn about these type of treatments. You know, I would say that injectable testosterone is more popular in men, but we do know that there's some risks associated with that, and that the testosterone pellet therapy is actually probably a better alternative for them to keep their testosterone levels more even. And it's actually a twice-a-year treatment. So I don't think that they know that this is available, and so it's nice to be on this show to help explain that we have some of these treatments that aren't what I would call traditional treatments. When I worked in primary care, you know, men would ask about getting their testosterone levels checked, and honestly, I would go to the supervising doctor I was working with at the time, and I'm like, what testosterone levels are we looking for? How do we treat it? And, you know, there's just a lot of uncertainty in the medical community about how to treat testosterone in men. For women, you know, I did gynecology for 8 years, and so I was very comfortable treating hormones in women, but I wasn't really treating men. And so when I found out about this group called BioT that's out of Texas, they actually do personalized dosing with testosterone based on blood work, age, and weight. And basically, it's like an algorithm, a computerized program where I put all this information and it tells me what dose to give that person. And it's awesome because I don't have to try to figure it out. And then we start with that, and we do blood work in 4 to 6 weeks after their treatment. We're able to see their levels. I assess how they're feeling. And, you know, like I said, I've treated many men in their 30s that didn't even know what was wrong with them. But it can lead to depression and fatigue, insomnia, which is trouble sleeping, low libido, which is low sex drive. And so they're suffering from all these things, and they don't even know it. And then usually the men are feeling really great, and so they'll get their wives or girlfriends in and say, hey, I think you should check out Wendy's services. And so I do treat a lot of couples, and so the men will refer the females in, the females will refer the men in.
It's that word of mouth that you were talking about earlier.
So,
it's like, hey, honey.
It's really great. And then we do offer some other treatments that go along with that, which I'd love to talk about on another show, but which is, you know, the P shot and the O shot, which also helps with sexual health for men and women, which are non-traditional treatments, but they're trademark procedures that I've learned. And I'm like one of the first providers to bring that here in Gainesville. And it's using platelet-rich plasma, so it's all natural treatments. So,
and what does that do? I mean, I know, like you say, there's so many different aspects to what you do.
Yeah.
Now you piqued my curiosity, so I might as well keep going down this road.
Yeah, so the P shot stands for the Priapus shot. Dr. Charles Reynolds was actually the inventor of that. And it's basically using platelet-rich plasma to, anywhere we inject PRP or platelet-rich plasma, it's going to increase blood flow, it's going to improve nerve sensitivity, and it's also going to stimulate natural collagen. So, for example, for the men, this treatment can help with erections. It can treat a condition called Peyronie's disease. And so, yes, it's a shot that goes in the penis. But it's, it can
Bet you didn't know that was going to be on the podcast on episode 119, did you, buddy?
Not quite.
So we have, we
got surprises for everybody.
Yeah, so I told you I wasn't shy.
She brought free samples, too.
I told you I'm not shy.
I'll let you handle that one there, buddy.
But we also offer something similar for females to help with sexual health. So it can also improve orgasm for females, lubrication, sensitivity. So in conjunction with the hormones, I've seen that those treatments have really been very beneficial for my patients as far as improving that area of their life. And it is hard to advertise that, or, sometimes that's a hard one, word of mouth. You don't really want to go around to your buddies saying you got a pee shot, maybe, or maybe you do.
So how do you market it?
Word of mouth.
Yeah.
Or when they're in there getting hormones, we talk about it. So usually they'll develop a comfort level with me about that. Females are a little bit...
So it's usually like they're in for something else, and then this is like an upsell or like an add-on is what we would call in the retail world.
Well, we do a hormone assessment sheet for them, and some of these questions are involved with that, and so we do address that. Mm-hmm. So
throwing it back to like the testosterone stuff, right? Yeah. I mean, you said things like insomnia, like people don't realize. Like, I'm just thinking, like, how do you know? I mean, it's because of the tests? Like, how do you know? I mean, straight up, I've got some, like, I never sleep. I got so much insomnia. You know what I mean? So when you're like, when I'm like hearing these types of things, how do you know it's related to, I guess, the lack of testosterone?
I don't think you would know until you do a blood test. And so that's where we start with our patients. Mm-hmm.
Okay.
Yeah. So we start with a blood test, and then I go over all the results with them. And then based on that, we have a conversation about what the treatment options are. And so I can also prescribe medications to help with some certain things. But, I think that when it comes to insomnia, you want to really treat the root cause, again, of the problem, and if it's a testosterone deficiency, then we definitely talk about that. But I really try to stay away from sleep meds as much as possible. So the CBD drops, I think, would be something that I would recommend. We just ordered in a sleep aid that's a natural supplement that isn't available, in the GNC or other stores here in town. So we do have access to a lot of natural alternatives. And we do prescribe, or I do prescribe medications for some things, but I really try to limit it to, what's only medically necessary. So that's kind of how I approach health problems, is I try to find a more natural solution, and then we move to medications if needed. But yeah, I'd love to talk about our joint injections, because that's really, one of the things that drove this business was treating people naturally. So you mentioned maybe you have some knee issues, but, I would see people come into me in primary care that were in their 40s or 50s doing CrossFit or other, playing, what is it called, the Frisbee game, just trying to be active on the weekends or whatever, and developing, knee pain or shoulder pain and elbow pain, other things like that. And there really wasn't a lot of natural treatments or other treatments besides steroid injections, or go see the orthopedist, or go to physical therapy, or just ice it and rest it, and to me that wasn't good enough. I felt like when I learned about platelet-rich plasma, I'm like, well, you can inject that anywhere, and you can make tissue and heal pain naturally and with little downtime. So this was became very popular with the elite athletes. Like Tiger Woods has had PRP in his knees multiple times. Steph Curry also for torn ligaments in his knee. Tanaka for UCL or elbow overstrain or tears. So it's amazing because, surgery isn't going to always fix a tear, and you may not get surgery if it's just a partial tear. They're going to recommend, rehab, usually, the orthopedics will. So this actually will go in and stimulate new collagen and what we call connective tissue, which will help strengthen those tendons and actually heal and repair them permanently. And so it can be a permanent fix to pain, and it also can help slow down the progression of arthritis. So that is really, what's driven this practice. Yes, I do these other treatments because I feel like it's a part of overall health and wellness, but getting people out of pain is very important.
Sorry, I was going to say, how long has the United States been able to perform the PRP injections? Because I remember when I first heard about it, I think it was Kobe Bryant. It might have been, but they had to go to Italy to get them because they weren't being, or maybe it was FDA, or you could speak to that, but like they couldn't do them here.
Correct. It wasn't that we couldn't do them. I think that people just didn't really know about them or know how to do them. So they would have to fly out of the country. You have to remember this is a procedure, so it's not a medication, so it's never going to be FDA approved. I do get that question a lot. Is this FDA approved or covered by insurance? This is a treatment. And so I would say not all PRP is created equal. So it is becoming more popular, more mainstream because more people have learned about it and are able to perform it. And I was one of the first providers to bring it here in Gainesville because I just saw the need, with my own patients in private practice working in primary care. I mean, I would shoot a steroid in the knee and then it was gone in 3 weeks. And then what do you have to offer that patient but just, go do physical therapy. And so when I had this, I just became like super excited to be able to offer it. And it's really not very difficult, but you do have to have the right equipment. You have to have, I've done thousands and thousands of dollars worth of training with the top experts in the country to learn about how to do PRP correctly. So some places, I would say may not be following the same protocols I follow, which are very standardized. And I also use what's called ultrasound-guided joint injections. So I train with Dr. Clark, who's a world-leading expert in ultrasound-guided injections for musculoskeletal injuries. So I've trained, right alongside the physicians, and I think sometimes people might question that. Oh, you're a nurse practitioner, you're not a doctor. But I have the same training as far as PRP is concerned as most physicians, maybe even more. And so I think it's my technique. I do a lot of specialized treatments when I do a joint injection that are, I would say, pretty much my secret that I'm not going to share. But I do basically not just treat the joint, but I treat all the tendons and ligaments around the joint to make them healthier and stronger. And that comes from just years of training in different modalities and training with different experts. So the American Association of Osteopathic Medicine, and I'm also certified to do prolotherapy, which is another type of treatment which is not as expensive as PRP and a great way to start out. Like, if you just got a little maybe UCL, like an elbow or medial lateral tendinitis. Works great for that. It costs $150. You come in, you get pain free, and I just treated a gentleman. I had injected what's called placental tissue matrix in his knee. He wanted to be able to play golf, and with COVID, he was getting to play a lot more golf, and then he was having this knee pain, and so we treated him, and he's doing really well. He's like almost 90% better. He's about 8 weeks out from his treatment, but has a little bit of what I would call patellar pain. That's pain in the front of the knee. So I brought him in today and we did a little prolotherapy, which is just a mixture of dextrose and lidocaine. Very inexpensive treatment, and I bet you that will get him pretty much all the way 100% pain-free. So, I think what I do is a little bit above and beyond what some people might offer, and all the equipment that we use is FDA approved. It's designed to make PRP, so this isn't just a regular, lab centrifuge that I'm drawing your blood and putting it in. Right. This is all sterile equipment. It's designed to make PRP, and then we're able to concentrate the plasma, your own platelets 5 to 6 times above normal. Some places are only getting like 1.5 or 2. So the outcomes and the success of my treatments are really, I think, based on a lot of different factors. It has to do with my training. It has to do with my injection technique. It has to use, it comes down to me using ultrasound and guiding this treatment exactly where it needs to go. I can see the tear on ultrasound, and then I can watch the needle go right into that area and then inject the plasma right into the tear. So it's pretty awesome. I think it's the coolest thing.
So did you say it's like a one-time treatment, or
sometimes it is?
You have to go back multiple times?
It depends on what treatment and what the problem is. So,
okay.
I usually let you know that up front. Like, I think this might be a one and done. With my placental tissue matrix, which comes from placental cells, it's actually like proteins that are extracted from the placenta. It comes from a biologic company called BioRenew, and It's like PRP on steroids.
I was about to ask how you get donors for that, but
I don't deal with that. I mean, that's the biologic company's job is to, harvest it, and they sterilize it, and it's all FDA regulated. So, when people say, is this FDA approved? I say, PRP is a procedure, so it comes from your own blood, so there's no approval process with that, except for the equipment that we use. But like with placental tissue matrix that comes from another donor, that is regulated by the FDA, so there's sterility that goes involved with that. But I will say I am the only one in town that has this product, or probably anyone in this North Central Florida, or maybe even all of Florida, because I learned about this product in California with my training with the top orthopedic surgeons that have athletes fly in from all over the country for this particular treatment that we have right here in Gainesville that people don't know about. I mean, it's really a gold mine in the sense of getting people back within a matter of 3 to 7 days, running 5 to 10 miles, so it's great for like marathon runners that don't want to take time off. I treat jockeys from Ocala that, ride 10 horses a day, and they can only take 3 days off, and, their knee looks huge, it's swollen, it's got all this fluid on it, and to be able to get people like that pain-free is just, it's amazing.
Yeah, so from the business side of it, though, you just recognized that opportunity and jumped on it?
Absolutely.
Why didn't anybody else?
I don't know. I mean, I saw an opportunity to bring something to Gainesville that
wasn't there.
That wasn't here. And I was a little bit ahead of the game, so that made it a little bit of a slow start. And that's kind of why I brought in
Was it something that was on your radar? Because I'm always fascinated by entrepreneurs who know what's coming right around the corner.
Well, when I learned about it, I knew this was going to be big. I know that PRP is going to be huge. It already is huge in Miami and Orlando. So any of the big cities, this is pretty common. I think because this is a cash-based business, though, people really need to take caution of who they go to, because there can be corners that are cut, which is going to sacrifice outcomes. And so, I met a gentleman on the phone, and he said he got a procedure down in Orlando for like $75. I don't even offer anything for $75. But I said, well, how'd that work out for you? He goes, well, I think I need another one. I'm like, well, exactly. If you don't use the right equipment, you don't go to somebody who is reputable.
Yeah, but how does the normal everyday person like me know, right?
Right.
Between you and the person in Orlando.
And that's where the word of mouth comes in, I think. And you go to people like, and trust. And I think developing relationship like this, now you know me, and so you might tell your friends that, hey, there's this person that does this right here in town. I go around and I do a lot of talks for the physical therapists here in Gainesville. I love to do talks. I love to educate, because they don't even know that it's available. But I'm sending my patients to them after treatment, and so they've got to know, how these treatments work and how these patients are going to recover and how they're going to respond to treatment. But you're right. I think it's only going to gain in popularity. I just sort of had to wait out, the time, and then the beauty of it is that I'm already an expert. By the time people have found out about it, I'm 3 years in, with all this experience, and I have a lot of data.
So that doesn't worry you at all with more and more competition?
No, it doesn't, because I think if you know that you're one of the best, you don't worry about competition. I know what I'm doing is the right thing, and I know my patients know it. And you can look at our Google reviews. I mean, we're up to about 78, I think, 5-star reviews. So if you just go to our Google website, you can read what the patients have to say. I don't pay them to do that. They're writing their testimonials, and I always ask them, they come to me and they say, you've given me my life back. I'm able to play with my grandchildren. You saved me from having a knee replacement surgery.
Yeah, it's super rewarding.
Yeah, it's very rewarding. And I'm like, would you mind just, letting the other people know about this? Would you write us a little review? And I had one 80-year-old gentleman write a whole letter. And he was the biggest skeptic starting out. He came to see me almost like a year earlier, and he was signed up to do a knee replacement. His son was a doctor, and he's like, well, I don't believe that this is going to work for me. And I said, well, what other options do you have? You can go on and do surgery, or you can try this first, because if this works, that's going to save you from having, potential complications from surgery and things like that. So he's been really
a letter
afterwards.
As a review.
Yeah, afterwards he was just, he was like, I was wrong. I didn't trust her in the beginning, and he said, but after the treatment, I knew it was the real deal. And he went back to his orthopedic doctor actually, and even before he had treatment, he told his doctor he wanted to do this, and the doctor actually gave him the blessing. You should try it. Go ahead. You don't have anything to lose but money.
How about real quick on a practical application on the Google business, Google review side? Like, I always find it super difficult to get people to leave good reviews. It's like in the world that we live in today. So
you don't have to try to get a bad one.
Yeah. You certainly don't have to do anything to get a bad one. Like, people, if you make somebody angry, they're going straight there, right?
Sure.
They're not even like coming to you to give you an opportunity to fix it anymore. Like, half the problems I find out about are like from a Google review, and then I have to reach out to the person, hey, what happened? And like, did you ever consider asking to speak to a manager? That's just out the window these days, right? But I find it very difficult as a business owner to actually get people to take the time to leave a Google review. And I just, we ask, we say, hey, people are like, oh my gosh, the experience was so great. Hey, that's so awesome to hear. Would you mind like leaving a Google review and telling others to, about your experience here? Because that really helps us bring in new business. I mean, is that what you're doing, or is it just, is there anything else that helps kind of get people to actually take the initiative to leave a review?
Yeah, that's a great question, and I have a good answer for you.
Good.
So we had like little cards made up initially. How did we do? Would you please leave us a review if you were, if you were or you weren't. I mean, it doesn't matter, but I mean, just leave us some feedback. And we couldn't get people to really do that. I mean, some people did, but it was cumbersome. So I learned from a chiropractor's office that I went to. As soon as I walked out the door, it was like, bam, on my cell phone, how did I do? And it was like super easy. It was like 5 stars there, and I just clicked that, and I was just super happy with my service. So I think making it really easy for your customers to leave a review is the key. If they have to hunt down or try to figure out how to leave the review, and for some people it's cumbersome, they don't know how to go to Google and then click on the link. So we found out about a company called Doctable, Doctible. Basically I pay that company a certain amount a month. And so every patient that leaves gets either an email or text of whatever their preference is. How did we do today? And so I will ask them when they're back there and they're telling me how awesome they feel and how thankful they are. I said, hey, would you mind, we're going to give you a little text after you leave. Would you mind just give us stars and rate us? You don't have to leave a review, because some people are like, I don't know what to say. I don't want to, leave my name or whatever. So most people don't care about that unless it's pea shot or something. But
I just had this awesome pea shot. It was an injection right into my penis, and
but
5 stars all the way.
Yeah, but I actually do have a testimonial on my website. I have a whole testimonial on my website about it.
Okay.
Yeah, so you can just.
Hey,
they'll go to the website, and I'm like,
Mike's gonna go get the pea shot. He's gonna leave you a 5-star review, aren't you, buddy? He's like,
I'll try anything once, I guess. I don't know.
I think finding the tools that make it easy for your customers to leave reviews is the key.
It's key.
Because we went from like 30 or 38 maybe, and we're up to like 78 in a couple months. So
cool.
I think that's
good.
Key.
I mean,
just trying to learn these little tricks that will help grow your business. So we know that's important for Google.
I think it's super valuable to our business audience because it's something that gets brought up often.
And people do look at those.
Yeah.
I know.
No, for sure. No doubt.
Now I'm shocked when I pull up a business and I see one review. I'm like, oh, forget it.
Makes you think twice, right?
Yeah.
So you have all 5-star reviews?
Yeah.
Okay, I'm just going to prepare you.
I got one negative one, and it's taken me probably 2.5 years to get rid of that.
Okay.
Yeah, I mean, I don't know why Google...
Prepare the heart for the first time you get a 4-star review and you're like, why wasn't it 5? I don't understand.
No. I mean, I am realistic in that sense, and I never tell people, how to rate us.
I took it, the thing is, as business owners, you take it so personally.
You do.
Like,
but
you take it so personally.
You can. You just keep providing awesome service, and if your customer service is amazing, which I can just already tell you guys are just by your personalities. I just think that you won't get really those negative reviews, and I think trying to head that off. If you can tell somebody's not happy, like trying to figure out what it is or why.
I think it's just important to know when somebody's not happy. And I think that's the hard part of 20. The year that we live in now. It's just people just like. If they have a problem, they'd rather get on Facebook and just tell the entire world their problem versus actually calling the place and saying, hey, my experience didn't go quite well today. Do you mind if I speak to the manager? And that just doesn't happen anymore.
Right.
Yeah. So that's the problem I have with it. That's just personally, though.
Well, I do sort of weed out my customers in the sense that...
Which I also think is super important.
Yeah. I think when you're first in business, you will take kind of anybody that comes your way, that's going to pay
Startup.
you.
Yep.
I'll just be honest and realistic about that. That was me. But now I think once you become more established, you can sort of interview your clients just like they're interviewing you. And I can start to tell now, like if I don't think it's going to be a good fit or they don't think it's going to work, the mind is super powerful. And when they start thinking that I don't think this is going to work for me, and I'm like, well, this might not be the treatment option for you, then, you might want to go on and do surgery. And if you're really believing that that's going to make the difference for you. And I don't let that hurt my feelings because my job is to educate people about the treatment options available.
Right.
And if they want to come to me and they want to get treatment, great. If they decide to go do something else, I don't take that personally either. But I can start to tell now, like if I think it's a good fit for our practice and I think that, or if I think that there's going to be issues. And if there is, I have the authority and the ability to say, I don't think that this is going to be a good fit for you, and I think you should look at other options. And I think that comes just with time, being in practice and feeling really confident in yourself, knowing that what you do is valuable, but everybody may not believe in it, and there's not everybody that might want to do that.
It's good. I can tell that it's amazing to me just from hearing you speak and only being in business for 3 years. Mm-hmm. I know that a lot of you've observed, practice and being a practitioner in other people's businesses and that kind of thing. But, it's very obvious that you know what you're doing, which is really cool. So
yeah, the hard part is not doing the treatments; it's running the business.
Yeah, I'm sure. I could completely empathize with that part.
Did you learn all you wanted to learn?
Oh, dude, I thought it was fantastic.
Book your appointment.
I thought it was fantastic. Well, why don't you wrap us up? You got any last questions?
I did have one. It sounds, if I was going to just read between the lines, it sounds like most of this is out-of-pocket expenses. Like this is not something that major medical insurance covers or anything like that outside of like, gynecology exams or anything like that maybe.
Correct. We don't take any insurance. I say that we don't work for the pimp. But I think
I love it. By the way,
I want to practice medicine the way I feel like it should be practiced, and the people that come to me, that's what they're looking for. They're looking for treatment options. Surgery can be really expensive, and I think some people get so focused on, it's not covered by insurance, it's not for me. But sometimes things through insurance are going to cost you more than it would out of pocket, and we have financing available through Care Credit. I think our pricing is extremely competitive, so we don't price gouge or upsell anything that we do. Actually, I think if anything, we probably undercharge for some of the services that we offer. But I think it's not hindered us in today's world. And I did worry about that, with COVID, and I'd always kind of feared like what would happen to us in a recession, and now I kind of come through that thinking that, I think we would be okay.
So can you share what a basic range of costs for like a platelet injection would be?
Yeah, I would just talk about joints for right now. And so like for a knee PRP injection, it runs $700, which is right in line with what Shands is charging, and I think the Orthopedic Institute as well. So we're very in line with what you're going to do. But I would say what sets us apart is the ease of scheduling. So most of the patients can come into me within 2 weeks and get their treatment probably within that 2 weeks as well. You don't have to have MRIs or other things to come in and see me and get treated. I'm able to look at it with ultrasound, and if I think an MRI is needed, I can order it. So I think we would just really streamline the process for people, and I think that is worth, sometimes paying a little bit out of pocket to get that one-on-one personalized treatment.
Cool.
Super interesting stuff. Excuse me. Please, why don't you tell our audience where they can connect with you?
Yeah, absolutely. Well, our website is a wealth of information. We have all of our services listed on there and explanations and testimonials. So that's where I would say if you're interested in learning more about what we do, I would go to PRPRegen.com. That's PRPRegen.com. And also calling our office for an appointment, 352-260-4061, or looking us up at PRP Regeneration Specialists. And we're also on Facebook and Twitter, and we do some Instagram.
Awesome. And you guys, I gotta let you know that this is the first time we're meeting, right? We've never met each other before, and I'm not even sure if this interview would have happened if it hadn't been for a nomination. And one of the things that we tell everybody is if you know somebody that you think would be fantastic for our show, and I have a pretty extensive network, which I'm excited about, especially been in Gainesville for so long. But I love the opportunity to hear about new businesses exactly like this one. So thank you so much for coming on the show. And if you know somebody that needs to be on our show, go to the website and nominate them. Go to whoagnv.com, click the link that says nominate guests, and definitely nominate those fantastic businesses out there so we can bring them into the studio and hear their story. This is fantastic. I learned a lot tonight. So thank you so much for joining us.
Thank you for having me.
Yeah, absolutely. And again, everybody remember that this podcast is not possible without our sponsors. So make sure you go visit our sponsors. And if you need to find out all of their information, go to whoagnv.com/sponsors. And we have links to their websites and to all of their info. And those sponsors make the show happen. So please support them. And that's it, you guys. We appreciate all of you. Make sure to share this with somebody. This is the WHOA GNV podcast, the podcast bringing you businesses and individuals that make you go, whoa. Give us your best whoa.
Whoa.
We will see you later. Bye.